Hello, future dental experts. Ready to test your knowledge and dive into the fascinating world of teeth? This practice test covers the basics of dental anatomy, from those pearly whites to the structures that support them. Don't worry, we'll keep it simple and fun. Grab a pencil, get comfy, and let's get started. A smile is a powerful thing, capable of brightening a room, breaking the ice, and even changing the course of someone's day. It's a universal language, understood by people of all cultures and backgrounds. But have you ever wondered what actually goes into creating a smile? What are the anatomical features and muscles that work together to form this simple, yet profound expression? For dental professionals, understanding the anatomy behind a smile is the first step to providing excellent dental care. It's not just about teeth, it's about the entire facial structure, the lips, the muscles, and the unique features that make every smile one of a kind. By learning about these building blocks, we can better appreciate the artistry and science involved in creating and maintaining healthy, beautiful smiles. Let's put your knowledge to the test. How much do you know about the lips and facial features that frame those beautiful smiles? These features are more than just aesthetic. They play a crucial role in speech, eating, and expressing emotion. Each part of the mouth and face contributes to the overall harmony of a smile. Here's a quick quiz. True or false? The philtrum is the groove between the base of the nose and the upper lip. The answer is true. The philtrum is that subtle vertical groove you see running from the bottom of your nose to the center of your upper lip. It's a small detail, but it's an important landmark in facial anatomy. This distinct feature is a key landmark in facial anatomy. The philtrum helps define the shape of the upper lip and is often used as a reference point in reconstructive and cosmetic procedures. Its prominence and shape can vary from person to person, adding to the uniqueness of every face. Next up, let's try a fill-in-the-blank question. The is the reddish part of the lip that acts as a transition zone between the skin of the face and the mucous membrane of the oral cavity. Take a moment to think about it. This area is what gives lips their characteristic color and texture, making them stand out from the surrounding skin. The answer is the vermilion border. This is the line where the colored part of your lips meets the normal skin of your face. The vermilion border is not only important for aesthetics, but also for function. It helps to seal the mouth and plays a role in speech and eating. This area is more delicate than the surrounding skin. The vermilion border lacks the protective outer layer found elsewhere on the body, making it more sensitive to environmental factors like sun, wind, and dryness. That's why it's so important to keep your lips moisturized and protected. Now, let's move on to the muscles that make smiling possible. Here's a multiple-choice question. Which muscle is primarily responsible for the act of smiling? Is it the orbicularis oris, zygomaticus major, masseter, or temporalis? Each of these muscles has a unique function in the face, but only one is the main driver behind that upward curve of the lips. The answer is the zygomaticus major. This muscle extends from the cheekbone down to the corners of the mouth. When it contracts, it pulls the corners of the mouth upward and outward, creating the classic smile we all recognize. This muscle pulls the corners of the mouth upwards, allowing us to express happiness, joy, and friendliness. The zygomaticus major works in harmony with other facial muscles to create a wide range of expressions, but it's the star player when it comes to smiling. And here's another true or false question. The nasolabial folds are the lines that run from the corners of the mouth to the chin. The answer is false. These folds are actually the lines that run from the sides of the nose down to the corners of the mouth. These folds, often called laugh lines, run from the sides of the nose to the corners of the mouth. They become more prominent with age and repeated facial expressions, serving as a testament to a life filled with laughter and smiles. Understanding these features helps dental professionals create natural, harmonious results when working with patients' smiles. So, the next time you see a smile, whether it's your own or someone else's, take a moment to appreciate the intricate anatomy and the many elements that come together to create it. From the philtrum and vermilion border to the zygomaticus major and nasolabial folds, every part plays a role in the beauty and function of a smile. By understanding these building blocks, we can better care for our patients and help them share their smiles with the world. Now that we've covered the exterior, let's journey inside the mouth. The human mouth is a fascinating gateway to the rest of the body, and it's much more complex than it might appear at first glance. As we open wide and venture in, we'll discover a world of structures, each with its own unique function and importance. So get ready to take a closer look at what's really going on inside your mouth. Get ready to test your knowledge on the structures that make up the oral cavity. The oral cavity is not just a space for food to pass through. It's a dynamic environment where digestion, speech, and even immune defense begin. From the moment you take a bite of food, your mouth springs into action, using its various parts to break down, taste, and prepare food for the rest of your digestive system. Let's see how much you know about these essential components. Fill in the blank. The blank is the roof of the mouth, separating the oral and nasal cavities. The answer is palate. The palate is divided into two parts: the hard palate at the front, which provides a rigid floor for the nasal cavity, and the soft palate at the back, which is more flexible and helps close off the nasal passages during swallowing. It plays a crucial role in breathing, speaking, and eating. Without the palate, it would be difficult to form certain sounds or keep food from entering the nasal cavity. The palate also helps create suction, which is especially important for infants when feeding. Here's a multiple-choice question. Which type of teeth are primarily responsible for grinding food? Is it incisors, canines, premolars, or molars? Each type of tooth in your mouth has a specific job. Incisors are sharp and used for cutting, canines are pointed for tearing, and premolars help with crushing. But when it comes to grinding food into smaller, digestible pieces, one type stands out. The answer is molars. Their broad, flat surfaces are ideal for crushing and grinding. Molars are located at the back of your mouth and are the largest teeth you have. They work together to break down tough foods like vegetables and meat, making it easier for your stomach to digest them. Without molars, chewing would be much less efficient, and you'd have a harder time getting the nutrients you need from your food. Next, true or false, the gingiva, commonly known as the gums, is a soft tissue that surrounds and supports the teeth. The gums are often overlooked, but they play a vital role in keeping your teeth stable and healthy. They form a protective barrier around the roots of your teeth and help prevent bacteria from reaching deeper tissues. The answer is false. While the gingiva surrounds and supports the teeth, it is a firm, resilient tissue, not soft. Healthy gums are usually pink and tightly bound to the teeth, providing a strong foundation. If gums become soft or swollen, it can be a sign of gum disease, which can lead to tooth loss if not treated. Taking care of your gums is just as important as brushing your teeth. And finally, fill in the blank. Saliva is produced by the blank glands, which play a crucial role in digestion and oral health. These glands are located in several places around your mouth, including under your tongue, inside your cheeks, and near your jaw. They work constantly, even when you're not eating, to keep your mouth moist and comfortable. The answer is salivary. These glands produce saliva, which aids in chewing, swallowing, and protecting teeth from decay. Saliva contains enzymes that start breaking down food before it even reaches your stomach, and it helps wash away food particles and bacteria, keeping your mouth clean. Without enough saliva, eating and speaking would be much more difficult, and your risk of cavities and infections would increase. So the next time you think about your mouth, remember all the amazing structures working together to keep you healthy. The tongue is an often overlooked hero of the oral cavity, responsible for much more than just taste. Let's see how much you know about this versatile organ. Which of the following is not a type of taste bud found on the tongue? Is it sweet, salty, spicy, or bitter? The answer is spicy. Spicy is actually a sensation of pain, not a taste detected by specific taste buds. Now, true or false, the tongue is primarily composed of muscle tissue. That's true. This muscular structure allows for a wide range of movements essential for speech and eating. Here's a fill in the blank. The small raised bumps on the tongue surface that contain taste buds are called papillae. These structures give the tongue its rough texture. And finally, true or false, the tongue plays a vital role in the initial stages of digestion. That's true as well. It helps to form food into a bolus for swallowing and initiates the digestive process. Understanding common dental problems is key to providing effective care. Whether you're a dental professional, a student, or simply someone interested in oral health, being able to recognize and address these issues is essential for maintaining a healthy smile. Dental concerns can range from mild discomfort to serious infections, and early detection often makes all the difference in treatment outcomes. In this section, we'll test your knowledge on some of the most frequently encountered oral pathologies. These are conditions that dental professionals see on a daily basis, and understanding them is crucial for both prevention and management. Let's dive into some common scenarios you might encounter in a dental clinic. Here's a question to consider. Which of the following is a bacterial infection that affects the gums? This is a fundamental concept in dental health, as gum infections can lead to more serious complications if left untreated. Is it gingivitis, halitosis, candidiasis, or bruxism? The correct answer is gingivitis. Gingivitis is a common and mild form of gum disease that causes irritation, redness, and swelling of your gingiva, the part of your gum around the base of your teeth. This common gum disease is characterized by inflammation and bleeding, especially when brushing or flossing. If not addressed, gingivitis can progress to periodontitis, a more severe form of gum disease that can result in tooth loss. Regular dental checkups and good oral hygiene are the best ways to prevent and treat gingivitis. Next up, let's talk about halitosis. True or false, halitosis, also known as bad breath, is always caused by poor oral hygiene. That's actually false. While neglecting to brush and floss can certainly contribute to bad breath, it's not the only cause. Halitosis can also be caused by a variety of other factors, including certain foods like garlic and onions, dry mouth, smoking, and even underlying medical conditions such as sinus infections, diabetes, or gastrointestinal issues. Sometimes medications can also lead to dry mouth, which in turn causes bad breath. That's why it's important for dental professionals to take a thorough medical history when evaluating a patient with halitosis. Let's try another fill in the blank. What is the condition where tooth enamel is eroded by acid, leading to cavities? This is one of the most common dental problems worldwide, affecting people of all ages. The answer is dental caries, also known as tooth decay. Dental caries occur when bacteria in the mouth produce acids that gradually destroy the hard tissues of the teeth. If left untreated, cavities can cause pain, infection, and even tooth loss. This common problem highlights the importance of good oral hygiene and a balanced diet. Brushing twice a day with fluoride toothpaste, flossing daily, and limiting sugary snacks and drinks are all effective ways to prevent tooth decay. Regular dental visits for professional cleanings and checkups are also essential for catching cavities early. And one more question. True or false, bruxism, the habitual grinding or clenching of teeth, typically occurs during the day. That's false. While some people may grind their teeth when they're awake, most cases of bruxism actually happen at night during sleep. Bruxism most commonly occurs unconsciously during sleep and can lead to a variety of dental problems, including worn-down teeth, jaw pain, headaches, and even damage to dental restorations. Dentists often recommend night guards to protect the teeth and reduce the impact of grinding. If you suspect you or someone you know may be grinding their teeth, it's important to seek professional advice to prevent long-term damage. Congratulations on completing this dental anatomy practice test. You've taken a great step towards mastering the fundamentals of this fascinating field. Remember, this is just the beginning of your journey into the world of teeth. Keep exploring, keep asking questions, and never stop learning.